Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A 50-year-old female has been followed by the psychiatric mental health nurse practitioner for over 6 years for a diagnosis of major depressive disorder, recurrent. The patient has achieved a successful remission with sertraline 75 milligrams daily. Today, the patient presents complaining of an acute onset depressed mood, tearful days, and difficulty concentrating for the last month. It has become a problem at work, and her boss has suggested that she might need to take some time off to, quote, take care of her problem, end quote. Further discussion reveals that the patient learned last month that her husband is having an affair with a coworker. She is so distraught and consumed that she cannot fulfill her work responsibilities, and she has completely cut herself off socially from friends and family. The psychiatric mental health nurse practitioner suggests that the next best step in her care should include which of the following? A, increasing her sertraline to 100 milligrams daily. B, a referral to psychotherapy. C, a referral to couples counseling. Or D, changing her pharmacotherapy to a serotonin norepinephrine reuptake inhibitor. Well, again, this is a plan of care question, but again, it's always a question of first, what do you think is going on? And then you develop a plan of care. I can't emphasize enough how important it is to have a diagnosis before you really develop a plan of care. I precept students routinely and almost always, especially in the beginning of the clinical rotation, I will have students who, they see a patient and then they present the patient to me and I will say, okay, well, what are you going to do? And the student immediately goes to, we can start this, we can increase this, we can add that or whatever. And I say, okay, well, back up. What's your diagnosis? What exactly are you treating? You don't see your preceptors go through this step by step by step because for us it's intuitive. We just do it. We know we have to have a diagnosis before we have a plan of care. But as you are developing and learning in this role, it's really easy to just start jumping to we can do this and we can do that. But when someone asks you to articulate the diagnostic criteria for the diagnosis that you are treating, you find yourself going, okay, well, wait a minute, and then going back to look it up, and none of that should happen. You should always have a diagnosis before developing a plan of care. And if anybody, like your boards, should, or like an insurance reviewer or an attorney during a deposition, if anybody should ask you to articulate how you came up with that diagnosis, you should be able to rattle off those diagnostic criteria just like that. So, of course, obviously, your interest right now is your boards, and your boards does expect you to know diagnostic criteria for commonly encountered phenomenon. So you've been given a story here, and before going forward in your brain, you should have a diagnosis in mind. So let's look at the highlights here. Okay, she's been being seen and managed for major depressive disorders, recurrent, for 6 years. She has had a successful remission on sertraline. Good, for 6 years. She's been on a remission on sertraline. Now today, acute onset depressed mood. She's tearful, trouble concentrating. It's a problem at work. Her husband is having an affair. She is so distraught and consumed, she can't fulfill her responsibilities. She has cut herself off socially. What's your diagnosis here? Now, remember, if you're going to say this is an exacerbation of her major depressive episode, her disorder, if you think she's having a major depressive episode, you should be able to articulate minimally 5 symptoms of a depressive episode from that SIGI CAPS mnemonic? Are there 5 of them occurring all at the same time in the last 2-week period? And what are those criteria from your SIGI CAPS mnemonic? The first S is what? It's about sleep, right? So is she reporting any sleeping problems? I is for interest. Is she reporting depressed mood or loss of interest or pleasure? And, she is. G, guilt, worthlessness, hopelessness. E for energy, C for concentration, A for appetite, P for psychomotor, S for suicidal ideation. Are at least 5 of those evident in this question? And the answer is no, there's not. What's evident in this question is she had been in a remission and she found out her husband's having an affair, and now she is depressed. She is having trouble concentrating. She is completely consumed, and she has cut herself off socially. So you can't articulate 5 of those 9 symptoms. So we really can't call this just, it's an exacerbation of her depression. What we do know is there has been a major life event that has caused a couple of symptoms that's making it difficult for her to perform her normal social daily functions. This is most consistent with an adjustment disorder. This is a maladaptive adjustment to a major event that's happening in her life. That being the case, B is the correct answer. Like I said, this scenario is consistent with a classic presentation of adjustment disorder for which the preferred intervention is psychotherapy. She's already on sertraline for her depressive disorder, and that's great. But the treatment of choice for an adjustment disorder is psychotherapy, and that's what we should do, is refer her to that. A is not correct. An increase in her medication at this point is not the best step. She's been in remission for a number of years. Her symptoms are clearly related to maladjustment to her marital circumstance. And C, a referral to couples counseling is not the answer here. I mean, without the spouse as part of this evaluation, it's just not possible to suggest couples counseling as the next step. Would it be appropriate or not? At the very least, the husband has to be part of that conversation. And certainly changing to another pharmacologic agent, D, changing her pharmacotherapy to an SNRI is not indicated. I mean, if any pharmacotherapy change is indicated, it would be an increase the sertraline, the one that we already know has been successful for her. But the real important takeaways from this question are, A, this is an adjustment disorder. You know that psychiatric diagnoses can exist comorbidly. I mean, it's possible to have more than one. She appears to have a major depressive disorder that has been well managed for years on her chronic therapy. Now, this bad thing happened in her life. She's having a couple of symptoms that recur, not enough to constitute a depressive episode, but a few symptoms that are maladaptive. They're interfering with her ability to work. That sounds most like an adjustment disorder, and the treatment of choice would be a referral to psychotherapy. So can't emphasize enough that knowing the common diagnostic criteria here for your boards in general really is helpful in being successful.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.